Imagine going out to your favorite place for lunch to get your usual dish. Then you take a look at the menu, see that there aren't any prices listed on like next to the menu items like they usually would be, but you go ahead and order anyways. And then after you finish, your eyes widen at the fact that the bill's so expensive. Um, in the healthcare system, when patients go for a visit to the hospital, they're usually completely unaware of the actual cost of their treatment, and it's only until after they've received the treatment is when they find out what they have to pay, and whether it's food, a trip to the spa, like a plane ticket to Bali, even consumers are normally informed of the price of the good or service that they want prior to buying it. They can choose different variations of it as well because they know they have options. And if healthcare is a service that we're buying, why are we initially unaware of the price tag and other options that we might have? Now, surprise billing or balance billing is when a person receives a bigger bill than they expect, and it's a problem because people can't pay for it. And the University of Chicago reported that 57% of Americans have actually dealt with surprise billing. And healthcare is something that each individual needs to have. Not having it poses risk to individuals because they might not be able to seek like proper health from proper health help, proper like help or care that they may need. According to Kaiser Health News, greater price transparency has been a popular policy prescription for America's high health costs, especially at a time when many patients have high deductible insurance plans and face larger copayments. And oftentimes people won't go to the hospital because they don't know how much a trip to the doctor will cost, and they're often afraid that it'll be too expensive for them to pay. And when people can't get the care that they need, their condition may like get worse and eventually lead to more costly services that could have been initially avoided if they were to make that first trip to the hospital if they when they first needed it. And in one case, Drew Calver had an unexpected heart attack in his home and was taken to St. David's Medical Center. And he was billed $164,941 for his total of 4 days of stay in the hospital and his surgery. And then his insurer only paid not even half of it, not even a quarter of it, and he was left to pay the rest. And there was no way, in fact, that he would be able to pay it when it was more than double his annual salary. And only around 10% of healthcare costs are even shoppable expenses. And there are many cases just like that, where like a patient is left no choice but to pay the expenses or whatever they were charged for the service because they've already received it. And hospitals like these inflate their prices because they inflate it and like they can, and then it drives up costs, and they can do it because patients don't know exactly what it is that they're paying for. And then an article I found on healthcare costs focuses on crowdsourcing, which is collecting information from the public to get feedback, and it provides helpful when a solution to a problem isn't very clear and easily identified. This type of system would be able to take like charges and costs and make like a comprehensible tool people could actually use. So, a solution to like the problem would be for hospitals to have like lists of the prices for each of the services readily available to patients and easy for them to understand. Um, the American the Association of American Medical Colleges defines price transparency as readily available information on the price of healthcare services that, together with other information, help define the value of the services and enables patients and other care purchasers to identify, compare, and choose providers that offer the desired level of value. That it should be in simple terms that people can understand, like I said, not medical jargon, which is kind of hard to interpret if you're not like a medical professional. And by having it, it would be easier for patients to reference and compare prices and choose their best option. Healthcare it shouldn't be something patients are afraid to get. And increased transparency would not only lower the cost but reduce medical errors, improve outcomes. The patient's overall satisfaction would be better, and this kind of change would allow patients to making overall better decisions about the services that they get while they know what it costs and what they're paying for. And this will provide an opportunity for healthcare organizations to differentiate themselves by offering services for like better prices. So transparency will ultimately help both the providers as well as their patients.